Hello and good evening, everyone. So welcome to another live session on EDEN 2. So this is the second live class for general microbiology. Okay, some technical issues is there. Okay, so in the first live class, we had already discussed about the general microbiology, immunology, and mycology and parasitology. Now, today we'll be focusing on bacteriology and virology. Okay, so like I had already mentioned in my first class, like on an average, microbiology together with general pathology, you can expect a total of like an average of like 14 to 15 questions for your NEET MDS examination. Okay. If you look at the recent information bulletin that was published for this NEET MDS 2025 exam, you can see that the subject-wise weightage was like very much same as that of the previous years. So we are expecting the same thing in the NEET MDS 2026 exam also. So like pathology together with microbiology, you can expect an average of like 14 questions. From microbiology alone, you can expect somewhere around like 7 to 8 questions for your NEET MDS examination. And if you look at the pattern of these questions that were asked in microbiology, like there are like straightforward one-liner questions can be expected, and then also image-based or clinical-based questions can also be asked. In the initial years of NEET MDS, like in the 17, 18, 19 and all, usually since this microbiology is a laboratory-based subject and basic science subject, they were mainly asking like straightforward, like one-liner questions were generally asked. But now, if you look at the recent years, more and more like image-based or clinically oriented questions were asked even from subjects like microbiology. Okay, so practice our mock test regularly. Okay, if you practice only, you will be encountering or you will be like able to see such clinically oriented questions, and you will get an idea about the pattern of questions that can be asked for your microbiology for the NEET MDS examinations. Okay, so regularly practice MCQs, then only you will get an idea about the pattern of questions that can be asked in microbiology. So in this session, like I have included all the three types of questions. There are like one-liner straightforward questions I have included, and also with that image-based and clinically oriented questions also I have included. Now, another thing that I want to tell you is that like after the COVID period, that is after the 2020 period, like for NEET MDS examinations also, you can expect like 1 or 2 questions that were related to coronavirus or the COVID-19 infection. Okay. So in the last live session, I had included one such question that was asked in the NEET MDS 2024 examination. So definitely you can expect such questions also. The content regarding the COVID-19 virus may be less, may be given less in your textbook. So like have a general idea about all the things that are related to coronavirus and the COVID-19 infection and post-COVID-19 infection, like diseases that are like mainly popular in the post-COVID-19 period also. Okay, you should have an idea regarding that also. Okay, so today we'll be mainly discussing on bacteriology and virology. If you look at the microbiology textbook itself, you can see that this bacteriology and virology constitute the main essence of this microbiology. So it is a little like vast, like lots of bacteria are there, lots of viruses are there. You should have an idea about the general characteristic of a bacteria, if it's a particular shape or if it's like anaerobic or aerobic, if it is like gram positive or gram negative, like that you should have a general idea about the uh, mostly seen bacteria or mostly studied bacteria. and also the cultural characteristics. Okay, the which culture media, if there is any special media for that bacteria, then you should know about the culture media for that bacteria, and in that culture media, how this bacterial colonies are formed. Okay, there are sometimes in some of the bacteria there will be like particular appearances for the growth of the bacteria. Okay, so you should have an idea about that, and any kind of special stain that is used to recognize that bacteria. Okay, so all this you should have an idea about regarding the viruses also. Okay, general idea about all the bacteria and viruses should be there. Okay, so let's move on to the questions, doctors. So first we'll start with bacteriology. So first question, the component of bacterial cell wall which is responsible for endotoxic activity is, like I always used to say in my live sessions, if you know the answer, like you can put it in the chat box. If you don't know the answer, you can tell like you don't know the answer in the chat box. Or if you're doubtful about an answer also, you can put that also in the chat box. It doesn't matter if it goes going wrong or anything. We are all in the learning process here. Yes, Dr. Saumya. Yes. Dr. Ashwin, any answers? Okay. So the component of bacterial cell wall which is responsible for the endotoxic activities is option A, lipopolysaccharide only. Okay, so I will tell you about the general structure of the bacteria first. So this is a general structure of a bacteria. So if you look at it, the outer layer or the outer component is the capsule here. You see here? Yes, this is the capsule. The outermost layer will be the capsule, and underneath it you will have a like outer layer, or which is also called as a cell envelope. Okay, so this cell envelope is composed mainly by two components. You will have you can see a rigid cell wall of the bacteria. Okay, so this is the cell wall, and underneath it you will be able to see the plasma membrane or the cytoplasmic membrane, and under the cytoplasmic membrane you will see the all the cell contents. Okay, all the cell organelles and cell contents will be seen. So this is the general structure of a bacteria. There will be a capsule, and there will be a cell wall, and there will be like plasma membrane and cytoplasmic membrane will also be there. Okay, so based upon its like gram staining properties. Okay, so that is the basic property that we use to differentiate the bacteria into like gram positive and gram negative bacteria. Okay, so based upon this gram staining properties, the bacteria can be divided into gram positive bacteria and gram negative bacteria. Gram positive bacteria means they uh, since they have a thick layer, what it does is that it will retain the dye. Okay, it will retain the primary dye. Okay, so the primary dye that we use for gram staining is something like crystal violet or methyl violet or gentian violet. Okay, so once we put that dye in for this bacteria, it will just retain it. Okay, and when we add a decolorizer, okay, when we add a decolorizer like the acetone or the alcohols, it will not get decolorized. Okay, it will retain that blue color. Okay, so such bacteria are called the gram positive bacteria. Now, gram negative bacteria, after primary staining, what it does is that when you add these decolorizers like the acetone or something like that, if you add the decolorizer, it will that blue stain will be completely washed off. Okay, that blue stain will be completely washed off. And when you add the secondary dye, okay, secondary dye will be usually something like in a red color, like the saccharin red or like that. It will be in a red color. Okay, so this gram negative bacteria, they will take up that red dye. Okay, whereas gram positive bacteria, it will take up that blue dye. Okay, so that's how it will appear under the microscope also. Gram positive bacteria will be appearing like in a bluish color, whereas gram negative bacteria will be appearing in more like a pinkish color. Okay, so why some bacteria are allowing the dye to get decolorized and why some are not getting decolorized? That is mainly because of its structure of the cell wall. Okay, so let's have a look at the structure of the cell wall of this gram positive bacteria. So if you look at this gram positive bacteria cell wall, you can see that these blue colored layers, yes, that is the peptidoglycan layer. Okay, since this gram positive bacteria has like a very thick peptidoglycan layer. That is why it is getting, the dye is getting retained in this gram-positive organism. Okay, so the main content of the gram-positive bacteria cell wall is peptidoglycan layer and the teichoic acid. Okay, so these two are the main contents of the gram-positive bacterial cell wall. Whereas if you look at the gram-negative cell wall, here is the gram-negative cell wall on your left side, you can see that it is also made up of a peptidoglycan layer. Then there is an outer layer which is called as the lipopolysaccharides. Okay, so this green color structures that you see here, yes, that is the lipopolysaccharide. And below that, you will have the outer membrane, which contains all the important proteins. And then below that, you have the peptidoglycan layer. Okay, so as you can see, the peptidoglycan layer is comparatively thin in case of gram-negative bacteria. Okay, so that might be the reason the dye is not getting retained, and because of its high lipid content also. The lipopolysaccharides are numerous in number, or because of the high lipid content, it is permeable to the secondary dye after decolorization. That is, secondary dye can easily come inside this bacterial cell wall. Okay, so these lipopolysaccharides, the green color structures that you see here, those are the ones that are mainly responsible for the endotoxic activity. So endotoxic activity means it can be pyrogenicity, like fever causing or any kind of lethal effect or tissue necrosis. All these activities are mainly seen in an infection because of this lipopolysaccharide presence only. Now, this lipopolysaccharide can be divided into 3 regions. That is like region 1, region 2, and region 3 is there. Mainly, this region 3 is involved in this endotoxic activity. Okay, so remember that gram-negative cell wall, lipopolysaccharide, and region 3, which is responsible for this endotoxic activity. Now, moving on to the next question. A bacteria gave the following reaction with catalase. Which of the following could it be? Yes. Following reaction. So if you look at this image, you can see that this is the catalase reaction, and you can see like bubbles or effervescence getting produced in this reaction. Yes, Dr. Soumya. Yes, others also can answer. Dr. Ashwin. Even if you are like doubtful about an answer, no issues. Okay, even if it goes wrong, no issues. You can answer. Okay, so let's see what the answer is. This option A is Staphylococcus aureus. Okay, so like before the numerous new methods for identification of a bacteria like the PCR reaction and all. Before that, in the primary stages, what we use to identify the bacteria is with the help of biochemical reactions. Okay, so we do like laboratory test of the biochemical reaction, and we identify the bacteria. We can get a probable diagnosis. Okay, we can get it like a probability, like this may be the microorganism, like that we can predict in case of the biochemical reactions. So there are so many biochemical reactions like the indole test, catalase test, coagulase test, like so many tests are there. So in this catalase test, if you look at it, this catalase test can be done in 2 methods. One is slide method and another one is tube method. Slide method means we are doing it on a microscopic slide, whereas tube method means we are doing it in a test tube. Okay, that's the major difference. And how this catalase test is done is that take a sample of the which you need to test for this bacteria. Okay, so take a sample and to that add 3% hydrogen peroxide. Now, if you add 3% hydrogen peroxide, if you are seeing such bubbles or like effervescence like this, then that shows that it is a positive reaction. If no bubbles or no effervescence is there, then that shows that it is a negative reaction. Okay, so why these bubbles are produced? Because this hydrogen peroxide in the presence of catalase, what happens is that it will release water and oxygen. Okay, so this oxygen is what you are seeing as bubbles or effervescence in this test. Okay, so if the catalase is present, then this oxygen will be released and you'll be able to see effervescence like this. Okay, so not all the microorganisms show this positivity for catalase test. There are some specific organisms which show positivity for catalase test, which I will show you. So these are the catalase positive organisms. Okay, so there is a simple way to remember these catalase positive organisms. You can remember the mnemonic CAT in lemon space. Okay, CAT means catalase positive, and in the lemon use only LMN. Okay, Listeria, Mycobacteria, and Nocardia. And the space, Staphylococcus aureus and Epidermidis, Pseudomonas, Aspergillus, and the these things also, like the fungus also, Candida and E. coli. Okay, so all those will be positive for catalase test. Then there are catalase negative organisms, mainly the Streptococci, Enterococci, Clostridium, and Haemophilus. Okay, so this test, this catalase test is mainly used to differentiate between the Staphylococcus species and the Streptococcus species. Okay, so this test is mainly done to like differentiate in a sample. If we want to like know whether Staphylococcus species are present, if it is Streptococcus species, that's where we mainly do this catalase test. Okay, the catalase test will be positive for the Staphylococcus species, and it will be negative for Streptococcus species. Okay, so you should remember that. Now, next question. A 25-year-old lady presented to the clinic with chief complaint of painful pimples on the back and scalp region. Sample taken from the site is cultured and deep golden yellow colonies are seen. Gram-positive, coagulase, and catalase positive cocci are present in the pus sample taken from the pimple. Which of the following may be the causative organism? Yes, doctors, answers please. Yes, you are right. Gram positive, coagulase and catalase positive, and again golden yellow colonies. Okay, so with a pus discharge is also seen. Okay, so these are all characteristics of Staphylococcus aureus. Okay, so let's have a look at the Staphylococcus aureus. So this Staphylococcus aureus is like cocci. Okay, like round shaped bacteria, round shaped blue colored bacteria that you see here. Yes, that is the Staphylococcus aureus. It is non-motile, non-sporing, and it will form something like this grape-like clusters will be seen in case of this Staphylococcus aureus. And if you look at the staining characteristics, it will be gram-positive. Okay, that's why blue color. Gram-positive cocci that occurs in grape-like clusters like this. Okay, so that's the characteristic features of Staph aureus. And culture characteristic. Okay, they can grow in nutrient agar itself. So in the nutrient agar, they will show something like this. Golden yellow colored colonies like this. Yes, this is the golden yellow colored colonies, and they can grow in the nutrient agar slope also, where they will show an oil paint appearance like this. Oil paint appearance like this in the nutrient agar slope, and in the Meconchus agar, they'll be showing pink colored colonies. Okay, so biochemical reaction, like we had already mentioned, it is catalase positive. It will be coagulase positive also. Okay, so what are the infections that can be caused by this Staph aureus, staphylococcal infections? If you look at it, almost the skin infections are the most common. So the skin infections like the folliculitis, the furuncle, carbuncle, and impetigo are very common. And the musculoskeletal disorders may also be seen, like the osteomyelitis, arthritis, and pyomyositis may be seen. Respiratory, tonsillitis, pharyngitis, along with the streptococcal species, that they can produce the respiratory infections, meningitis in case of the CNS infections, and pyemia, bacteremia can also be there. And urinary infections can also be there, which is mainly caused by Saprophyticus species. Okay, so these are the main infections that are caused by Staphylococcus. So we had seen about the biochemical reactions of the Staphylococcus aureus and the infections caused by them, and all the other characteristic features also. Now moving on to next question. The non-suppurative complication of Streptococcus pyogenes infection is. So what is the non-suppurative complication of Streptococcus pyogenes? Yes, doctors, answers please. Yes. You're right. It's option A, acute glomerulonephritis. Okay, so Streptococcus pyogenes. We had already discussed about Staphylococcus. Now we are going on to Streptococcus. Streptococcus means the word streptos means twisted or coil. Okay, so this is also gram-positive cocci only, but they will be in a chain. Okay, just like this blue colored chain that you see here. These cocci will be arranged in chains or maybe in pairs also. Okay, so usually you can see the cocci like this blue color necklace you see. Yes, you will be seeing the cocci like this. Now, these Streptococcus species can be of like three types. Okay, so based upon their reaction in the 5% host blood agar, they can be classified into three types. Okay, so the first one is the alpha hemolytic streptococci. So this alpha hemolytic streptococci in the blood agar, they will be producing a greenish discoloration like this. Why greenish discoloration? Because they are capable of only producing partial hemolysis. Okay, they cannot completely destroy the RBCs. They can only destroy it partially. Okay, so that's why it is causing greenish discolorations like this. You see here? Yes. Then next is the beta hemolytic streptococci. In the beta hemolytic streptococci, like complete hemolysis happens. So it will be usually the culture, if you look at it, it will be usually colorless or maybe like pale yellow color can be seen. Next is the gamma hemolytic. In the gamma hemolytic, like no hemolysis is happening. The organisms cannot hemolyze the RBCs at all. So it will be usually red in color like this. So under the alpha hemolytic streptococci, you have the viridans and the pneumonia group, and the beta hemolytic, the pyogenes and the Escherichia group, and the gamma hemolytic, you have the Enterococcus faecalis group. So this Streptococcus pyogenes under the beta hemolytic streptococci, that is the most important and medically important Streptococcus pyogenes that we need to focus on. Okay. So the Streptococcus pyogenes infections, they are mainly caused due to release of toxins like the hemolysins, streptolysin O and streptolysin S toxins can be released, or because of the pyrogenic exotoxin or the streptokinase, DNase, like all these toxins can be released from the Streptococcus pyogenes, and it can cause two types of infections. One is the suppurative diseases, that is the pus discharging or like the suppurative diseases it can cause, and next one is the non-suppurative diseases. If you look at this non-suppurative diseases, it is mainly caused as a sequelae of these streptococcal infections. Okay, that is like before like 1 month or 4 to 8 weeks before, some kind of streptococcal infection has happened in that patient. So after like 2 or 3 months, you'll be seeing some kind of complications for the same patient. Such kind of complications are the non-suppurative diseases. Now, if you look at the suppurative diseases, like I had already mentioned, along with the staph, it can cause respiratory infection, and so skin infections like the cellulitis, erysipelas can be there, and necrotizing fasciitis, toxic shock syndrome, genital infections are all mainly caused due to Streptococcus pyogenes. And non-suppurative diseases, which was asked in the question, there are two non-suppurative diseases that are usually caused by the Streptococcus pyogenes. One is acute rheumatic fever. Okay, one is acute rheumatic fever, and another one is the post-streptococcal acute glomerulonephritis. Okay, so what do you mean by this post-streptococcal acute glomerulonephritis means? You will be able to see like a rapid dysfunction in the kidney due to the inflammatory response that is produced as a result of this streptococcal infection. Okay, so that is called as post-streptococcal acute glomerulonephritis. It is mainly caused due to a type 3 hypersensitivity reaction, and mainly responsible by the group A hemolytic streptococci also, which is called as the nephrogenic streptococci. So this Streptococcus pyogenes, it belongs to the group B or the beta hemolytic streptococci, right? But some of the group A beta hemolytic streptococci can also produce such kidney diseases. So they are also called as nephrogenic streptococci. So in case of this glomerulonephritis, you will be able to see hematuria, like blood in the urine, oliguria, hypertension, and edema are all features of this glomerulonephritis. So, two non-suppurative diseases are only caused by this Strep pyogenes. One is the acute rheumatic fever, and another one is the acute glomerulonephritis. Now, next question. Which of the following bacteria is more important for producing cellulitis? Yes, which of the bacteria produce more involved in producing the cellulitis? Yes. Lots of option A today. Okay, so cellulitis means it is the inflammation of the dermis and the surrounding subcutaneous tissue. There will be no abscess or there will be no pus discharge or nothing like that will be seen. There is no definite borders for the cellulitis. Okay, it is like very diffuse in nature. And the area, if you touch and see, it will be very warm and erythematous like this, reddish in color like this. And edema will be seen and it will be tender on palpation also. Okay, so it is kind of an acute bacterial infection, which is mainly caused due to group A streptococci. That is group A streptococci, mainly the Streptococcus pyogenes. Okay, so group A, beta hemolytic streptococci. And along with that, staph can also contribute to this cellulitis, but the main bacteria that is involved in causing the cellulitis is pyogenes only, Strep pyogenes only. Yes, Streptococcus pyogenes is beta hemolytic. Yes, beta hemolytic streptococci only. Under this beta hemolytic Streptococcus pyogenes is divided into various groups, like group A, group B, like that is there. Under that, the group A is more commonly involved in cellulitis. Clear, doctor? Okay. Now, moving on to next question. This question was asked in the recent NEET MDS 2024 examination. The gas gangrene is caused by, is it Fusobacterium, Actinomyces, or Clostridium, or Corynebacteria? Yes, which of these bacteria causes gas gangrene? Yes. Yes, doctor, you are right. It is option C, Clostridium. Okay, so Clostridium, cluster means like spindle shape. So this Clostridium, it contains like gram-positive anaerobic organisms. Okay, and they are spore-forming also. So it contains many species like the perfringens, tetani, botulinum, and the histolyticum. And these species are mainly responsible for causing this gas gangrene, food poisoning, tetanus, and botulism and all. So this Clostridium perfringens type A, which releases a type of toxin which is called as a alpha toxin, which is mainly involved in the formation of gas gangrene. Okay, so initially, if only the skin and the subcutaneous tissue is involved, then it is called as anaerobic cellulitis. Okay, if it is just anaerobic cellulitis, then we will not call it as a gas gangrene. Only if it involves the muscle tissue also. When it involves the muscle tissue, it will result in anaerobic myositis. Okay, so when it when the anaerobic myositis happens only, we will call it as a gas gangrene. Okay, next question. Identify the Clostridium species based on the spore arrangement in the given figure. So the Clostridium we had already discussed. This Clostridium, it has like a bacillary body and it produces spores also. Okay, so based upon its spore arrangement, okay, the spore arrangement will be different for different species. So in this given image, based on this given image, which Clostridium species can it be? Yes, doctors, answers please. Is it tetani or tertium or perfringens or bifermentans? Which can it be? Yes. Any guesses, doctor? No issues if it is going wrong also, no issues. So which can it be based upon the spore arrangement? Okay. Okay, I'll tell you. Actually, it is option D, Clostridium bifermentans. Okay, I'll tell you these things. So we had already discussed about the Clostridium species, positive, anaerobic, and spore forming. Okay, so it will have a bacillary body like this. this line-like thing, yes, that is a bacillary body. And the round-shaped things, yes, those are the spores. Okay, so the spores will be usually wider than the bacillary bodies. So it will sometimes give like a swollen appearance like this. So there are like 4 types of spores can be seen in 4 types of species. So in Clostridium tetani, it will form the spores at the end, at the terminal end. And the spores will be usually spherical in shape like this. Okay, spherical shaped spores at the end of at the terminal end of the bacillary body can be seen. Now, if you look at the tertium, again, the spores are at the terminal end only, but it will be somewhat oval shaped. Are you able to recognize the difference between these two? This is like completely round, whereas this is like a little bit oval shaped spores will be seen. And in case of perfringens, it will be like subterminal. Subterminal means not at the terminal end, but a little bit away from the terminal end, but not at the center also. Okay, so between the center and the terminal end, you can see the spores like this, which will be oval shaped. And bifermentans. Okay, bifermentans is the one which produces the spores at the center of the bacillary body like this. Okay, so this is the characteristic feature of Clostridium bifermentans. Now, next question. A 6-year-old boy develops a mild fever and a sore throat. On general examination, his tonsillar pillars were covered by gray-white discharge and cervical lymphadenopathy is noted. Culturing is done to detect the microbe and the following image is obtained. The colony characteristics of the microbe involved are all except. Okay. Yes, you're right, doctor. So always like read 2 or 3 times when such questions appear. Like the questions which contain except or like choose the following which is not true or choose the following which is not false. Or in the options, you can see something like both of the above, both A and B, none of the above, all of the above. Like if such words are included in the question, then I will suggest you to read it like 2 or 3 times because these words are there to confuse you in the exams. Okay, so always read such questions 2 or 3 times and understand what they are asking and then only answer the question. Okay, so in this question, they had clearly given that this is a boy patient, a child patient, and he's having fever with sore throat and gray-white discharge is seen in the tonsillar pillars. Along with that, cervical lymphadenopathy is also seen. Okay, so we are talking about diphtheria here. Okay, so you see this mainly seen in the child patients, like gray-white discharge in the tonsillar pillars, along with the lymphadenopathy, fever, and all can be seen. So these are the characteristic features of diphtheria, which is caused by the bacteria, Corynebacteria. So this Corynebacteria, it has like gram-positive club-shaped swellings, and it is also called as the Klebsiella bacillus. Why Klebsiella bacillus? Because Klebs was the first one who introduced, who like discovered the bacteria, and Loeffler was the first one who cultured this bacteria. Okay, so this is also called as Klebsiella bacillus or the KLB. Now, under the Corynebacteria, like lots of species are there, like the diphtheria, ulcerans, striatum, urealyticum, all are there. This Corynebacterium diphtheria is the most important one among them, which causes diphtheria, bacteremia, and the endocarditis like that can all be caused. So corny means it is the club shape, and diphtheria means it is like a rough leather, because the pseudomembrane that you're seeing here, that will be like very rough and leathery in nature. Okay, so that's why the name Corynebacteria is given. Now, there is some special stain for like detecting this Corynebacteria. The special stain that we usually use is Nisser's or Albert stain. Okay, so this under this Nisser's or Albert stain, it will this Corynebacteria will appear something like this, like V-shaped or L-shaped arrangement of bacteria will be seen, and it is called as Chinese letter or the cuneiform arrangement of bacteria. Now, this green colored bodies that you see, yes, that is the bacilli. And at the end of this bacilli, at the terminal ends of this bacilli, you'll be able to see like purple blue colored round structures, yes, that are the metachromatic granules. Okay, they are also called as volatile or Bay-Bernstein granules or the polar bodies. Okay, so this is the granule and this is the bacilli. Okay, so this is the special strain of this Corynebacterium. Now, you can culture this Corynebacterium diphtheria also. So under the telluride blood agar, okay, you can use telluride blood agar for culturing this Corynebacterium. Now, if you culture this Corynebacterium under diphtheria, under the telluride blood agar, you will be able to see three types of colonies. Okay, so based upon the appearance of three types of colonies, it is divided into three types. One is the mitis, gravis, and the intermediate. So under the mitis, you will be able to see flat, shiny, black colonies like this. Okay, so it is also called as poached egg colony. Okay, so mitis will produce something like a poached egg colony. And gravis, it will produce something like a flat colony with a raised dark center and crenated edges. Okay, so this colony is named like daisy head colony. Okay, so these are all the like the subspecies of the Corynebacterium diphtheria. And next, last one is the intermediates. In the intermediates, you will be able to see a dull granular center with glistening periphery, which will be compared, which we call it as a frog's egg colony like this. Okay, so these are the three types of colonies that are seen in the Corynebacterium diphtheria. So in the question, it was asked, the colony characteristics are all like which of the following one is not a colony characteristic of this bacteria. Okay, so frog's egg colony, it is there. Poached egg is there and daisy head is also there. But medusa head, okay, medusa head is not seen in Corynebacterium diphtheria. It is seen in Bacillus anthracis, okay, which is responsible for causing anthrax infection. Okay, so medusa head appearance will usually see in Bacillus anthracis, whereas the poached egg colony, the daisy head colony, and the frog's egg colony are all seen in Corynebacterium diphtheria. Next question, identify the type of bacteria shown in the image given below. Is it Vibrio or Staph or Strep or Corynebacterium? You can like readily rule out Staph and Strep because you can, we had already discussed about it. Yes, it's Vibrio, like pink colored or comma shaped bacteria you see. Yes, that is a characteristic feature of option A, Vibrio. So this Vibrio cholerae, which is responsible for causing the cholera infection, is a gram-negative organism. Okay, like pink-colored organisms will be seen, which will be usually comma-shaped. Both the ends will be tapered in nature. Comma-shaped bacteria is seen. They are like motile organisms. Okay, they are aerobic and they are motile organisms. So when you look at it under the microscope, it sometimes they may be arranged in parallel rows like this. Okay, so when Robert Koch looked at it under the microscope, he was able to see this bacteria as parallel rows and under the microscope. Okay, so he gave it the name of like fish in stream appearance. Okay, so how the fish move in the stream, such appearance was given by this Vibrio cholerae bacteria also. So he gave it the name of fish in stream appearance. It is non-sporing and non-capsulated. It can grow in almost all the agars like nutrient agar, blood agar, and McConkey agar. It can grow. And one characteristic feature of this Vibrio cholerae is that it will grow very well under the influence of sodium chloride. Okay, that is like salt. It will grow very well under the influence of this sodium chloride. Okay, so the transport medium of Vibrio cholerae is like a important one. It is a very different media from the other bacteria. The transport media that we use for this Vibrio cholerae is Venkatraman Ramakrishnan medium and Carey Blair medium. In this media, it contains like lots of crude salt. Okay, so since it grows well on the NaCl medium, like lots of crude salt are involved in this transport media. And there are some special media also for its growth, like the alkaline bind salt agar, chlorochloride tipticus, tellurite agar, and the thiosulfate citrate bile salt sucrose medium. Okay, so these are all the culture media that can be used for the growth of Vibrio cholerae. Now, one simple test to identify the presence of this Vibrio cholerae is the string test. Okay, so in the string test, what you can use is that take the medium that you want to test, and to that add 0.5 percentage sodium deoxycholate in saline. And after like 2 to 3 minutes, if you look at it, take a loop and try to like try to take the when you try to take the sample, you will be able to see a string like this. If you are able to see a string like this, then that shows that the Vibrio species is present in that particular sample. Okay, so this is called as the positive string test. So this is one of the methods for easily identifying this Vibrio cholera species. Now, next question. Most commonly used selective media for the isolation of Mycobacterium tuberculosis is, which one is it? Is it Loeffler's serum slop or Lowenstein-Jensen medium or the Thayer-Martin medium or the Wilson-Blair medium? Which is the most common one that we use for the isolation of Mycobacterium tuberculosis? Yes, doctors, you are right. So the answer is option B, Lowenstein-Jensen medium. So Mycobacteria, it is the name suggests mycobacteria. Okay, like myco means fungus. So Mycobacteria means it is more they are referring to a fungus-like bacteria. Okay, because of its shape and all those things, they are referring it to a fungus, but it is a pure bacteria only which is causing the disease tuberculosis. So it is a slender, branched, filamentous, rod-shaped bacteria. One characteristic feature of this mycobacteria is that it has mycolic acid in its cell wall. Okay, so since it has mycolic acid in its cell wall, it resists the decolorization, and it is also an acid-fast bacilli. Okay, so it can be stained with Ziehl-Neelsen staining or the fluorescent dyes like auramine, rhodamine O can also be used for staining this Mycobacteria species. It is very slow growing, aerobic, and non-motile, non-capsulated, and non-sporing also. There are like various subspecies under this Mycobacteria. One is the tuberculosis complex, okay, which is responsible for causing the tuberculosis infection. And another one is the non-tuberculosis mycobacteria. And the last one is the saprophytic mycobacteria. So these are the three groups of mycobacteria that is usually seen. Now, usually the most commonly used solid media for culturing this mycobacteria is this Lowenstein-Jensen media. Okay, so this is the growth of Mycobacterium under the Lowenstein-Jensen medium. This Lowenstein-Jensen medium contains henseck, salt solution, asparagine, and malachite green and other selective agents, which is mainly used for the growth of Mycobacteria. Now, other than Lowenstein-Jensen medium, you can also use Loeffler's serum slop and Pavlovsky medium also, which are both solid media. And there are liquid media that can also be used, like the Dubose or the Middlebrooks medium can also be used. Okay, just have a look at the names of the media alone. Now, next question. Which of the following bacterial cultures show red fluorescence when exposed to UV light? Is it Bacteroides fragilis or Porphyromonas gingivalis or Provotella melaninogenica or Fusobacterium nucleata? Yes. Yes, you are right. It is option C, Provotella melaninogenica. Okay. So Provotella, this Provotella species was like previously included under the bacterioids, but now they had like separated it from the bacterioid species and they had given like a special category for them. So this Provotella, it is an anaerobic gram-negative bacilli, and it contains many species like the melaninogenica, Bacillus denticola, and Provotella intermedia. Okay, which we like commonly seen in the perio infections and all. Okay, so in the melaninogenica, it will be very easy to like recognize this melaninogenica because it produces like black or brown colored colonies in blood agar. Okay, so this is the blood agar, and if the this Provotella melaninogenica species are present, it will produce some black or brown colored colonies like this. Now, if you take this culture plate and like put it under the ultraviolet light, then you will be able to see brick red fluorescence like this. Okay, so this is a characteristic feature of this Provotella melanogenica only. Okay, so such brick red fluorescence under UV light is mainly seen in Provotella melanogenica only. Okay, so not just the culture media, the stains, if any cloth or if any cotton is stained with these infections by the Provotella, if you look at it, if you look at those materials under the UV light also, they will also give this brick red fluorescence color. Okay, so that's more about bacteriology. Now we are moving on to virology. So the BSL-4 level infection is, okay, so what do you mean by BSL? Biosafety level 4 infection is, like, which one of the following is a biosafety level 4 infection? Is it Ebola or SARS-CoV-2 or the rickettsia or the Mycobacterium TB? Which one can it be? Biosafety level, the protocols are given by the CDC. Ebola. Okay. Yes, doctor, you are right. It is option A, Ebola only. Okay, so this biosafety level protocol is given by the Center for Disease Control and Prevention. So in the laboratory, there are something like the we are dealing with the lots of like dangerous microorganisms in the laboratory. Okay, so for the safety of the people who are working in the laboratory and for the public also, a particular lab must follow certain protocols, okay, while dealing with the special microbes or with the normal microbes also. Okay, so that is mainly given under this biosafety level protocol. Okay, so it contains like a set of biocontainment precautions, and it is mainly used to isolate such dangerous biological agents in the laboratory facilities. Okay, so there are 4 levels for this biosafety level. These things, it can be considered as a pyramid, and there are 4 levels. One, in the level 1, we are mainly dealing with the low risk microbes, okay, that does not cause any disease to the humans. Okay, as we go higher in this pyramid, in the BSL-4 level, we are going to deal with very exotic microbes. Okay, very dangerous microbes we are going to deal with. Okay, so this is the BSL pyramid. So if you look at it under the BSL-1, it contains microbes which are not known to cause any disease in an immunocompetent humans. Okay, such like the bacteria, yeast, the Staphylococcus, Streptococcus, such bacteria which are not known to cause any disease to an immunocompetent human. All those bacteria are involved under the BSL-1 category. In the BSL-2 category, if you look at it, like moderate hazard to the personal and the environment can be there, like the herpes simplex virus, common cold viruses, they are all included under the BSL-2 category. Under the third category, mainly the organisms like TB and the SARS-CoV-2 virus are usually involved under the BSL-3 category, which can cause serious or potentially lethal diseases via inhalation. Okay, through inhalation, we can get serious infection from these kind of microbes. Those are included under the BSL-3 category, and under the highest category, that is the most exotic and dangerous microbes, are involved under this BSL-4 category, which includes the Ebola virus and the smallpox virus, which is like really life-threatening, and no vaccines or treatments are also not available. Okay, so such categories are mainly involved under the BSL-4 category. Okay, so this is the BSL pyramid. You should have an idea about which all organisms are included under the 4 categories. 1 is the least toxic, 4th is the 4th has the highest toxicity. Now, next question. During window period in HIV infection, which of the following statement is not false? Okay, so here they are purposefully the question is put to confuse you, like which of the following statement is not false. Okay, they can just give it like which of the following statement is true. Okay, but to make you a little bit confused and to make you think a little bit, they are giving the question as which of the following statement is not false. That is, which of the following statement among this is true during the window period in HIV infection. Is it the HIV antibody tests are negative, or the viral components cannot be detected in this phase, or the infection cannot be transmitted in this period, or none of the above? Yes, doctors, answers, please. Yes, you are right. So HIV, your human immunodeficiency virus. Okay, so it causes the AIDS disease and acquired immunodeficiency disease. And if you look at the period from the infection, that is the point where a person is getting infected till the antibody formation happens. Okay, so that period is called as the window period. Okay, so this window period is the first period that will be seen in an HIV patient. That is from the time of infection till the antibody starts appearing in his blood. Okay, so that is the window period. So first is the window period, and next it will progress to acute HIV infection. Like all the symptoms of like infectious mononucleosis will be there, like the fever, lymphadenopathy, and like all the symptoms of infectious mononucleosis like symptoms can be there in case of this acute HIV infection, which will then progress into an asymptomatic phase. Okay, so after some time, it will progress into an asymptomatic or latent infection. That is, there will be no symptoms will be seen in the patient. Then again, after like a few years, persistent generalized lymphadenopathy can be seen. That is, without a reason, the like 2 or 3 lymph nodes will be like swollen in the patient. Okay, so that is another characteristic. And then it will again progress into AIDS-related complex. That is a fully blown AIDS. Okay, so all the infections that are like seen in the AIDS will be seen in this patient also. Okay, so usually it takes like 2 to 8 weeks to 3 months for the antibodies to appear after the infection. Okay, so from the point of infection, the antibodies will start appearing only after 2 to 8 weeks. So during this time, that is called as the window period. Okay, so during this window period, the affected person will be highly infectious. Okay, the antibodies may not be present in his blood, but the patient is usually highly infectious. And the how to recognize that patient is in the window period is by we can like detect the viral components in his blood. Like the P24 antigen assay will be positive during this period. Okay, so that's how we recognize that, okay, this patient is infected with HIV, but he had not started showing the antibodies in the blood, but he will be positive for HIV. Okay, P24, if you check the P24 antigen assay, that will show the positive results. Okay, so that is the main thing in the window period. So if you look at the window period, the HIV antibody test will be negative and the viral components can be detected. The P24 antigen assay is positive. Infection cannot be transmitted. No, the patient will be highly infectious during this window period also. Okay, so the only true statement out of all the 4 is the HIV antibody tests are negative. Now, moving on to next question. A dentist suffered from hepatitis B infection 3 months back. His laboratory tests are normal, but he is not allowed by the medical board to do surgical practice. This is because he is an inactive carrier or a healthy carrier or a convalescent carrier or a paradoxical carrier. Yes, doctor's answers, please. Yes, you're right, because he is a convalescent carrier. Now, what do you mean by a carrier? Okay, so a carrier is a person who has the pathogenic microorganism inside him, but no symptoms will be there. Okay, no disease or no ill effect will be produced because of that bacteria. Okay, so such persons are called the carriers. Now, these carriers can be of 2 types. We have the healthy carriers and the convalescent carriers. Like healthy carrier means he has the pathogen inside his body, but no disease is caused by the pathogen. So such patients are called as the healthy carriers. Whereas convalescent carriers means he had the disease, he had symptoms of the disease, but now the recovered from the disease, and now the patient is like recovered from the disease, but the pathogen is still inside his body. Okay, so such carriers are called as the convalescent carriers, and based upon the time period, the carriers can be divided into like temporary carriers which last less than 6 months, and the chronic carriers which last for several years. Okay, and then based upon the like how the person got the pathogen, the carriers can be of two types. One is the contact carrier and another one is a paradoxical carrier. The contact carrier means this particular person gets the pathogen from the patient itself, whereas paradoxical carrier means it is more like a carrier to carrier transmission. Okay, so the pathogen, he got it from another carrier. So such this is like the different types of carriers that you can see. Now, coming to the hepatitis B infection, it has a long incubation period, like it takes like 1 to 6 months, and the recovery period also is also as long as that, like 1 to 2 months. Time will be the you will take to recover from the disease also, and the time taken for eliminating this virus from the body is also long. It usually takes 6 months after the infection. Okay, so in the question, it was given like the patient, the dentist, he got the infection and recovered from it like 3 months back only. Okay, so he is a carrier. Okay, because only after like the 6 months period only, the virus will get completely eliminated from the body. In some cases, okay, in some rare cases, like in like around like 10% of cases, the patient will be like chronically infected and the virus will be there inside the body, and it can cause complications, like it can progress into cirrhosis or hepatocellular carcinoma, like that. In some cases it can progress to such like huge risk also. Okay, next question. A 40-year-old man underwent kidney transplantation. 2 months after the transplantation, he developed fever and features suggestive of bilateral diffuse interstitial pneumonia. On microscopic examination, owl's eye-like inclusion bodies are observed. Which of the following is the most likely etiological agent? Is it, yes, doctors, answers please. Yes. Owl's eye-like inclusion bodies. That is the key point that you can see here. Okay, so this is the patient who had already completed the transplantation. So definitely he will be under immunosuppressants. And so he had developed like fever and pneumonia and all. So these are all pointing towards a cytomegalovirus infection. Okay, so what do you mean by the cytomegalovirus? It belongs to a group of viruses, which is also called as the herpes group of viruses. Okay, so this herpes group of viruses contains like types, so many types, from type 1 to type 8 is there. So the type 1, is the herpes simplex virus, and 2 is also the herpes simplex virus type 2. So the type 5 is the cytomegalovirus. Okay, so the type 5, which is the human herpes virus type 5, that is called as the cytomegalovirus. It is an enveloped virus, which is a double-stranded DNA virus, and it can cause infections in almost all the organs in our body. Okay, from encephalitis, retinitis, pneumonia, hepatitis, gastroenteritis, and can result in transplant rejection also, can cause infection in almost any part of our body. Okay, and another characteristic feature is that this cytomegalovirus has the capacity to cross the placenta and can cause like infection in the fetus also. Okay, so that is it is called as a teratogenic virus. Okay, so this cytomegalovirus is called as a teratogenic virus. Now, when this virus attacks the tissues, it can cause changes in the cells. There will be like a swelling of the cells, and there will be like lots of inclusion bodies can be seen inside the cells also. Okay, so one method to identify the cytomegalovirus infection is like with the help of a biopsy picture like this. Okay, so the cytomegalovirus infected cell will appear something like this. This is the owl's eye inclusion bodies. Okay, the cell is a little bit ballooned or swelling is seen in the cells, and also inclusion bodies like this will also be seen. This is the owl's eye inclusion bodies. Owl's eye inclusion bodies are seen in cytomegalovirus infection, whereas like the owl's eye appearance of the cell is usually seen in the Reed-Sternberg cells in the Hodgkin lymphoma. Okay, do not get confused between the two. This is cytomegalovirus infection, and this owl's eye-like appearance in the outside nuclei is also seen in the Reed-Sternberg cells in the Hodgkin's lymphoma. Okay, moving on to next question. A 5-year-old boy presented with swelling on both sides of the face below the ears with 4 days duration. It first started on the left side, and then 3 days later, right side is also involved. Immunization to this disease can be achieved by which of the following vaccination? Sorry. Yes. Yes, doctor, you are right. It is option A, MMR. Okay. So swelling on one side first, then the other side is also involved. This is a characteristic feature of mumps. So mumps is also called as epidemic parotitis, and it is mainly caused due to the virus which belong to the family paramyxovirus. Okay, so under the paramyxovirus, you have like lots of viruses involved, like the rubella virus, the measles virus, the mumps virus are all included under the paramyxovirus group only. So first, there will be some kind of prodromal symptoms will be there. Then the swelling will start appearing in the one side of the parotid gland. Then it will be appearing in the other side also. And another characteristic feature that you see in boy patients is that there will be swelling and pain in the testicles also. Okay, so these to remember the characteristic feature that you see in mums, you can use this mnemonic, which is called as POMP. So parotitis will be seen, enlargement of the parotid gland. Orchitis, that is the epididymal orchitis, will be usually seen in the male patients. That is swelling and pain and enlargement of the testicles will be seen. Meningitis can be seen as a complication, and pancreatitis can also be seen as a complication of this mumps. Okay, so this is the mumps virus, and you see the lipid bilayer membrane and the M protein and all. Yes, this is the mainly responsible for this symptoms that you see in mumps. Okay, so mainly the disease is mainly seen in the children, and this virus can be like grown in embryonated eggs or the chick embryos. Okay, so based on that, we have the mumps vaccine, which is a live vaccine, which is mainly obtained with the help of Geril Lin strain. Okay, so this Geril Lin strain is the infective strain of the mumps. Okay, so we are using this Geril Lin strain for manufacturing this mumps vaccine, and usually this vaccine is given only after 1 year. Okay, only after 1 year for the babies, and it is contraindicated in pregnancy and immunodeficiency. Okay, since it is a live vaccine, it is contraindicated for immunodeficiency patients and for those patients who are like hypersensitive to neomycin or the egg protein. Okay, only one single subcutaneous injection either alone or along with the MMR vaccine can be given, and it provides a protection for around like 10 years protection can be there. Okay, so you should remember the name here. It is the Geril Lin strain that can be asked. So that's all for today. Any doubts, doctors? Any doubts regarding the bacteriology and virology topics? Okay, doctor. So thank you. Thank you so much for attending the session. If you have any doubt, then you can put it up in the WhatsApp group, or you can contact me directly also. No issues. So keep studying, like revise regularly also. There will be mock test for this microbiology subject also. Try to complete that also. We'll be starting the new subject soon. So before we go on to the new subject, make sure that you learn and attend all the mock tests regarding this subject. Okay, so keep learning, keep revising, and all the best for your preparations and do well. So thank you for attending the session. Thank you so much and good night. And I will see you for another live session. Goodbye.